will also be translated into Hindi, and so that there is the languages available to support the training that we've just carried out. The 14 protocols for the safe reopening of nurseries were issued by the National Emergency Crisis and Disasters Management Authority, the NCEMA, and these must be adhered to reopen nurseries. ADEC, the Ministry of Education, and SPEAR have produced a set of operating guidelines to help the nurseries implement these 14 protocols. There are 5 documents which support the training sessions, and this is what we have based this training on. Tonight's session, we'll be introducing 3 of the guidelines. We are going to be looking at guideline number 1, know the latest facts. Guideline number 2, hygiene awareness, and guideline number 3, hand washing. As we move through this evening's presentation, we'll be having a look at the guidelines and seeing what they say. And we'll also look at the documentation that you would require for each section to complete ready for submission. Please ensure that you have copies of the operating guidelines available with you, the roles and responsibilities, the self-assessment and other documents, so that as we go you can annotate them and you can see which parts that we're referencing. By the end of this session, we hope that you'll be familiar with the guidelines and all associated documentation that support these, that you'll understand the roles and responsibilities that you have as a leader to ensure the safety of children, families, and the nursery staff once we reopen, that you'll know how to implement the rules and regulations relating to guidelines 1 to 3, that you'll be able to reflect and accurately complete the self-assessment form, and that you'll complete all requirements for guidelines 1 to 3 within the operating plan. So Rafi would like to do a quick poll, if that's okay with you. We'd like to see how confident people are at the moment in implementing the guidelines. So could you take a few moments to read through these different responses, and please can you correctly tick or fill in which one you think most aptly you're feeling at the moment. We've got quite a large number of people on tonight, so I think it's going to take a little few more minutes. How are we doing, Rafi?
51%.
Ooh, we're getting there.
Almost there.
Fabulous. Keep polling, people.
Another 30 seconds, Lara.
Perfect. That's brilliant. Thanks, Rafi. Are we almost there, Rafi?
Almost there. Just another few seconds.
Right, let's have a look. So people are looking for clarification. They'd like to understand them better. We've got some people that haven't had a chance to read the guidelines yet, so they don't know the expectations. So we've got quite an even coverage there. Fabulous, thank you. Thanks, Rafi. Let's move on. So COVID-19 is a coronavirus disease. It's an infectious disease that's from a newly discovered coronavirus. It spreads through droplets of saliva when somebody's infected, and they cough and sneeze. So it really is important at the moment that we exercise good respiratory etiquette. Things like coughing into a flexed elbow. Okay, these guidelines apply to the nurseries in both the private and government sector, and it's all Emirates. So these are federal guidelines and they apply to all 7 Emirates. What I need to add here is that it's really important that you also refer to your own licensing authority, as some licensing authorities are having additional requirements that you may need to adhere to. So please do refer to your own licensing authority and ask if there are any extra requirements that you do need to adhere to. Okay, so you should have received 5 documents that relate to the reopening of the nurseries. You should have a nursery reopening operational plan, the operating guidelines document, the nursery reopening operational plan manual, the nursery post-COVID-19 reopening plan template, the nursery reopening operational guidelines, roles and responsibilities, and the post-COVID-19 nursery reopening self-assessment. It is really important that you look at these documents together and not in isolation, as they work together to provide a complete picture of the requirements for reopening. Within the documents, you'll see that there are 9 guidelines that you need to comply with. These are guideline number 1, know the latest facts, guideline number 2, hygiene awareness, guideline number 3, hand washing, guideline number 4, social and physical distancing, guideline number 5, staff and child sick leave and attendance, guideline number 6, crisis management, guideline number 7, positive relationships with parents, guideline number 8, supporting vulnerable populations, and guideline number 9, well-being. In today's session, just as a quick reminder, we'll be looking at guidelines 1, 2, and 3. It's important that you know that one of the documents is entitled Roles and Responsibilities. Within this guideline, you'll see that there are groups of different people who are responsible for different areas of the requirements. These include the owners, the nursery principal, nursery staff, nurses, cleaners, and parents. It's critical that you create within your nurseries a culture whereby people feel comfortable to ask questions if they do not understand something. It's important that you perhaps consider putting together a frequently asked questions document for people in your setting so that they have something to refer back to and reference. If you do this, it's important that you ensure that it's regularly updated with any changes and updates that are released. It's important that you ensure that all stakeholders have received communication on their roles and responsibilities, and that you've considered the languages that you may need to share this information in. It's important that this information is clearly understood, and offering it in their native language may support this. Clarification of these guidelines is critical to ensure the safety of the children in your care. It's for this purpose that this training, the word principal also covers nursery manager, owner, and head teacher. The roles and responsibilities at the beginning of the document, there's also reference to the basic principles. These include social and physical distancing and hand washing, ensure that there's good practices within the setting and that social distancing is referenced throughout the setting with signage, and that this is reinforced to staff, parents and children. It's important that you notify parents and staff that if they're unwell, they need to stay home. It's important that your staff are able to identify symptoms, and it's also worth considering asking or sending home information to parents that allow them to identify the signs and symptoms of COVID also. Hygiene and safety must be at its highest levels within your setting to protect all stakeholders. It's important to take into account the well-being of everybody that has any involvement within your nursery. COVID has had an impact on many people, and it's important that we support people and that they feel that they are supported. It's also important that we have transparency. So it's important to share what we do within our settings so that parents are aware and that staff have good communication in place so that they understand as well what's expected of them. As I mentioned earlier, I just want to reinforce it once again. Please note that each of the licensing authorities may have their own reopening requirements based on the core guidelines that have been provided. Please make sure that you speak to your authorities and you work to these individual specifications. Okay, so within the self-assessment document and the operational plan, there are prerequisites to reopen. These include a valid commercial licence, a valid educational licence, your civil defence certificate, MOH approval, and evidence that you have either an approved nurse that's employed directly by the setting or that you've contracted in a nurse. Please ensure that before you submit your documentation online that your licences are in date. So guideline number 1 is know the latest facts, and it really is important that your staff are informed with current and reliable information, that the sources in which you get your information are reliable and recognised sources. So this slide has on it the telephone number for the Ministry of Health and Prevention hotline. That's a really good piece of information for you to ensure that your nursery staff and that your parents have. Other reliable sources include the Department of Health, the Ministry of Health, HARD, UNICEF and the World Health Organization. Please try to avoid sharing information that comes from sources other than those listed above and ensure that your staff are aware of this also. So Rafi, it's time for another quick poll. We would like to know how informed people feel on COVID-19. Do you feel confident? Do you feel you have some knowledge but you'd like to improve it? Or don't you feel confident in the knowledge that you have? Just give you a few minutes to complete that poll.
These polls are starting to grow on me. It kind of gives us a perspective of what and how the early child educators are receiving their information and how they're interpreting it.
I think there's an awful lot of information out there. It's a case really of making sure that those sources are really good, reliable sources that people are using. How is the polling going?
Much faster than the first one.
There's fewer questions, Rafi.
%81%.
Woohoo!
Almost there. Thirty more seconds.
Brilliant, let's see. So it's quite interesting. We don't have very many people that don't feel confident. We have some people that feel they have some knowledge but would like to improve, and then it's quite an even split between that and feeling confident in the knowledge that they have. Okay, thank you very much, Rafi.
The floor is yours.
Thank you. Guideline number 1, know the facts. It's important that you ensure that within your setting, you maintain 50% capacity, a maximum of 50%, I should say. It's important that the information that we have on COVID is used to update the policies that we have in our settings, and that we're using current and up-to-date information. It's also important that you take into account any local legislation and any local guidance that's in place. It's important that you communicate the changes that you've made in your policies to staff and parents. And it's important that you also provide information to parents on COVID so that they have the updates and they have reliable information to use. You may also wish to consider giving children information about COVID, but obviously this needs to be done in an age and stage appropriate manner. Perhaps have a reflection and think how you can communicate this with your parents. Where possible, we encourage you to use paperless communication, and that you set communication expectations so that parents and staff know where to go for the latest updates and the latest information. When people have busy lives, they would like the information to come to them. They don't want to go around and start looking for updates and information. Also, when communicating with staff and parents, consider the languages in which you communicate the information in. Where possible, discourage parent WhatsApp groups, as these are often very difficult to manage in terms of communication and what's shared and where the information is coming from. Sometimes you may find that unreliable sources are being shared. It's also important that you consider carrying out online training sessions for your staff, providing them with the latest information, again, considering the languages that you use to deliver this in. And when you're delivering sessions like this, it's important that you build within them opportunities for people to clarify what they know and ask any questions that they have. It really is important at this point that you don't assume that people know things, that you actually make sure and reinforce the knowledge that they have. It may also be worth considering asking your nurse to deliver this, as she has the medical knowledge and training. It's important that the staff understand the importance of these new guidelines for the prevention of COVID-19, and that they understand that safety within your setting is the responsibility of everybody. Plan with your team how you can update your policies and procedures for these new MOE guidelines and ADEC and SPEAR, and ensure that when you do so, these guidelines are made into workable policies and procedures. Consider sending out to parents updated information in the form of letters or leaflets, highlighting the things that have changed within the setting and referencing links for reliable sources for further information. Guideline number 1, there are several sections that you need to look at on your self-assessment form. It's really important when you look at this that you reflect on your setting and where it is currently, and that you're very honest as to where you are. Look at the guidelines that you've partially met or not met, and plan how you can move these forward so that you do meet them. Remember that the self-assessment document is a living document, and therefore you can work on it and update it until everything is met. Also consider, as you work through the document, not just ticking it, but ticking it and perhaps putting a date with it so that you can actually see the progress that that's being made, and you can see how you're coming together as a setting to meet the requirements that have been set. Within the reopening plan template, there are several areas that need to be completed as well. Within this, you need to identify how you're going to find the latest updates and which sources you plan to use. You then need to communicate within this section how you will update your staff, your parents, and possibly your children on this information. It may be worth considering allocating a member of staff who goes and looks for the information on COVID and then shares it in ways that are appropriate to the audiences. Again, consider the languages that you communicate this in. And again, where possible, paperless communication. So perhaps consider emailing it out, doing it through your app, your social media, or your website. Ensure as well that you've explained to parents where they can check regularly for information, and encourage them to be proactive in checking communication from the nursery. You also need to ensure that throughout the setting you have information on signs and symptoms to prevent the spread of COVID-19. Here you might wish to share posters that you have up in your setting. Consider things that show the signs and symptoms, but also how you prevent it through hand washing and social distancing. You may also wish to put together some leaflets that can be shared with parents, and other information sheets that can be put together in multiple languages. just like to reinforce that it's really important that you have accurate and current local information that you're sharing from reliable sources. Guideline number 2 looks at hygiene awareness. So for the cleaning procedures, it's important that no more than 5 days before you officially open, you have a full sanitisation done of the nursery. The sanitisation does not need to be completed by the time you submit your documentation. It needs to be completed once you have received your NOC. What we suggest here to complete your self-assessment form is that you have identified a company that you are going to proceed with, that you have your quotes in place for carrying this out, and that perhaps you put in place a provisional booking so that you're ready to reopen as soon as the NOC is released. It's important that when you put together your hygiene procedures and your cleaning procedures, that you refer to sites like the Ministry of Health to ensure that you have accurate hygiene guidelines in place. It's important that you have a nominated member of health and safety staff. We say that this is needed to check and monitor the implementation of hygiene within your setting. We suggest that you perhaps consider this being your nurse, as they have the relevant knowledge for this and they are able to monitor this setting-wide. Ensure that whoever is your designated health and safety officer is able to communicate regularly with the management, so the management has a good understanding of the hygiene practices within the setting and the levels at which you're operating. Use monitoring and recording of information to ensure that your hygiene within your nursery isn't compromised and that relevant named individuals are accountable. On your cleaning rotas, instead of just ticking when areas have been cleaned, consider initialing it and putting a time so that people really do feel accountable for the jobs that they're doing. The common areas in the nursery need to be cleaned every hour or after every use. This really applies also to frequently used areas, including door handles, dining tables, seat rests, elevator keys, and so all of this needs to be included within your setting cleaning checklist. Also, within this part of the guidelines, it's important that you have information on what happens if there is a positive case within your setting. This will include ensuring that the people that are involved in dealing with this are wearing full PPE, and that you ensure that the correct chemicals are used to decontaminate the area and dispose of any items which need to be double bagged and securely stored for 72 hours before they are disposed of, in line with DOH requirements. Consider buying in and having in stock several sets of full PPE, so that's the full white suit, so that should you have an incident, you have everything ready and the right PPE for the staff to wear in this situation. It's important that before you reopen, that your staff receive adequate training about the hygiene practices that you have in place. So consider carrying out in-house training online so that you have given all staff members a full understanding of the cleaning processes that need to be in place. It's the principal's responsibility to ensure that the staff uniforms are washed daily. It's also important that on arrival, all of the nursery staff and children's bags and shoes will be cleaned and sanitised on arrival within the nursery. So you need to plan how you're going to manage this. One way, and something to consider, is perhaps having a tray that the children and staff walk through that contains sanitizer, so as they walk through it, their shoes are sanitised. For staff members, it's important that they keep an additional set of clothing on site so that if their clothes become contaminated, they're able to change immediately and their clothing washed. It's a good idea to designate a member of staff in the mornings for wiping down the children's bags on arrival as they come into the nursery and wiping down the lunch boxes. All class bags or children's bags need to be stored outside of the classroom, and only the lunchbox and water bottle will be taken in. Prior to these being taken into the classroom, they must be wiped down with sanitizer. It's important throughout the setting that you have signage that encourages hand washing and demonstrates the correct procedure to carry out, and that you have signage that shows respiratory hygiene practices. This means covering coughs and sneezes. These need to go throughout the building, and they need to have content relevant to the audience. So you need to have some that are suitable for adults and also some that are suitable for children, so more pictures and displayed at child height. Any signage that you have throughout your setting should be laminated so that it can easily be wiped clean. And within your daily routine, it's important that you have regular opportunities where you remind the children to wash their hands. And obviously, if there's a child that's perhaps coughing or sneezing, that you remind them of the correct etiquette in an age and stage appropriate manner. It's important that throughout the setting and in the bubbles, you provide adequate hygiene supplies and that they're readily available for everybody to use. Cloth towels are not to be used within the setting. Everything has to be disposable. Consider how you will ensure that you have adequate supplies within the setting. It's important that you have tissues, disposable paper towels for use in the bathroom, wall-mounted hand sanitizers which have an alcohol-based sanitizer of at least 65 to 90% alcohol within the reception area and other areas that are used by staff, children aged between 2 and 4, and parents. You also need to ensure that you have adequate disinfectant and cleaning materials that effectively meet the MOH cleaning standards. It would be good practice to carry out an audit on the products used within your setting and ensure that they have the required approvals and then move forward and buy in the supplies that you require to open and ensure compliance. Carry out an audit to check that your hand towels and soap dispensers are easily accessed by both children and staff. It's important that hand sanitizers are wall mounted out of the reach of children and that you have signage around your sanitizers to show the correct use of hand sanitizer. Also, please add signage that says they are not to be used by children under 2 years of age, just as a reminder. Carry out a walk through your setting and audit the locations for dispensers. Are they in the right place? Are they before you enter an area? Are they before you enter your building? Are they before you go into admin spaces? Are they outside the clinic? Are they available both indoors and outdoors in your play areas? Also consider perhaps getting each staff member a small sanitizer that they can carry in their pockets so that it's always available to them. Natural ventilation is encouraged, and when first returning to nursery, this may be a little hard due to the high temperatures. But as it cools down, please try and ensure that your windows are open, obviously taking into account safety, and this just encourages natural airflow through your buildings. Staff need to consider wearing face shields and face masks, and this is obviously based on your staff members' comfort level. It's important that young children can see the staff members' lips and expressions, but obviously this has to be in balance with how individual staff members feel about this. It's important when entering common spaces that staff members wear face masks and that they have gloves on. Consider that as you're exiting bubble rooms or classrooms, that you have a supply of gloves readily available so that staff can easily put them on as they exit the area. In all nappy changing and toileting areas, it's important that you have available masks, gloves and disposable aprons. Ensure that these are readily available in adequate supplies and that you have signage in the bathrooms and the changing areas that reminds staff that they must wear masks, gloves and disposable aprons when changing children, and that these must be changed in between children. It's important that any of the communal spaces that you're using are cleaned regularly. And staff, when moving between clusters, must maintain a distance of 1.5 metres, especially in the communal areas. If this is not possible, if staff cannot maintain distances of 1.5 metres in communal spaces, then they need to consider perhaps eating and taking breaks within the classroom. When the weather permits, as much as possible, consider moving your routine into your outdoor spaces. If you have a spacious outdoor area, you could consider partitioning it, and so that each class has a designated space that they can use throughout the day. Any staff that are not assigned to a bubble, for example, the admin, should have a scheduled time to use the staff room, with cleaning scheduled to be carried out in between their usages. Ensure that throughout your setting there's social distancing signage, and ensure that the signage is spaced at the right distance apart by measuring this. Also ensure that you have social distancing signage outside of the nursery, so that this promotes social distancing to parents at drop-off and pick-up times. If you're a nursery that has an elevator inside, please also remember that you need to add signage into your elevator that promotes social distancing. The children's cubbies need to be clearly labelled, and they can have one child using one cubby. It's important that you communicate to your parents exactly what the child needs for each day, so that they don't bring in any additional items that you have to store, and therefore the cubbies have the right size for what's needed. Any of the children's bags have to be wipe cleanable, so you need to inform parents that anything that comes in needs to be easily cleaned, and bags will be stored outside of the bubble rooms. Any large equipment that you use, this includes high chairs, seating, photos, tables, needs to be laminated and be specific to one child. So it's important that they are named and labelled, and again, the labels really need to be laminated so they can easily be wiped down. Have a look through your classrooms and remove and pack away any learning resources and toys that cannot be easily cleaned. It's not going to be possible to rotate learning resources between bubbles. So the equipment that a bubble has is what the bubble will need to use. So it's important that you have adequate equipment in each bubble for their usage. If you wish to retain soft furnishings, these need to be easily washable, and they must be washed daily. If you wish to keep carpets within your settings, these need to be wet vacuumed daily, but obviously this has to be the settings decision on what is manageable for them. Managing the resources in your setting is going to be critical moving forward. Many countries have reduced the daily offering on a less is more approach. This means that you retain children's interests by having resources to rotate, so you don't put everything out at once. You make sure that you've planned which resources are going out on which days, so that you have items to swap and exchange within your bubble. This also means that cleaning of resources is much more manageable for each bubble team. Some settings have also considered creating kits for each child. These may be Ziploc bags which are named for one specific child, and they'll contain that child's resources for use within their bubble. This could include things like scissors, paintbrushes, pens. Some kits also have small tubs of Play-Doh for them to use that way. Again, this needs to be done in an age and stage appropriate manner, because this may be appropriate for slightly older children, but probably not possible for younger children. If any learning resources have been coughed on, sneezed on, or put in a child's mouth, they need to be removed from the room, and they need to go straight for sanitisation. This has to happen before they are returned to the learning area. Some nurseries may wish to consider operating a tub system. So you would have 2 tubs outside your classroom. You can get large tubs, some of them coming on wheels from hypermarkets, and labelling these, one with a green sanitised label and one with a red unsanitised label. And this just allows you to have in place a clear system for cleaning, so that every member of your bubble team knows exactly what is cleaned and sanitised and what is not. Using books in the nursery is obviously incredibly important, and it's important that if you do this, you consider laminating your books so that they are easy to wipe clean. If books are shared between bubbles, it's important that they are sanitised and left for 24 hours before being moved on to the next bubble. Children must not share beds or bedding. So it's important that any cots or beds are labelled clearly with the name of the specific child that will use it. Bedding must also be labelled with a specific child's name. It's important that rubbish is removed regularly from the setting, and all PPE equipment needs to be disposed of in a separate bin. This then needs to be double bagged and held within the setting for 72 hours before it's disposed. When cleaning, it's really important that you have a cleaning protocol that you've developed in your setting. This could include cleaning it first with soapy water and then allowing it to air dry and then spraying it with a sanitizer before it's returned to a classroom. Consider now, before you reopen, pooling all of your books together if you don't wish to rotate them between bubbles and have a 24-hour period where they're out of use. Consider putting them together and then separating them between the bubbles so that they remain in one bubble and they're not rotated. As I mentioned earlier, the cots and beds need to be labelled clearly with children's names, and when it comes to storing them after use, it's important that they are not stored next to beds from another bubble. So you need to ensure that they're separately stored so that there's room between them. It's important as well that children use their own set of bedding. So again, there's no shared bedding. So this needs to be labelled with a child's name. Either encourage parents to bring in bedding from home that's left in the setting, or if you're a setting that provides bedding, again, you're going to need to label this with children's names. Consider having 3 sets of bedding for each child so that you have one set that's on the bed, one set that's a spare in case there's an accident, and then obviously your third is in the wash. All bedding must be washed within the setting. There are strict protocols in place for the handling of food. It's important that the food and also the tubs and any boxes that the food is in are also sanitised before they enter the classroom. Within your classroom, you need to have an area that's set aside for the storage of lunch boxes, and before placing the lunchbox into that space, they need to have been sanitised. Where possible for the older children, it's important that we encourage the children to be as independent as possible. So consider writing home to the parents now and consider explaining to them the importance of independence. That includes toileting as well as eating. Where possible, encourage the children within the setting to handle their own food containers, but sometimes this can be quite difficult. Where possible, encourage that parents send tubs that are easy for the children to utilise themselves. Children must bring from home their own sets of cutlery. If a staff member is going to handle food or a child's food box, it's important that they first wash their hands and then put on gloves, and the gloves need to be changed between handling different children's food boxes or food. Where children have bottles, where infants have bottles, it's important that you encourage a parent to bring each day the required number of bottles and that they bring in tubs of milk powder that can be left within the setting. This means that you don't have to have the issue of sterilising bottles on site, as sometimes parents have different sterilisation methods, and this will just avoid any issues that may occur there. It's important within each classroom that staff and children have access to a supply of drinking water that they can top up bottles with. Ensure that when they do this, the staff are wearing masks and gloves, and that the vessel that you're pouring the water into doesn't make contact with the water as it's coming out of whichever item you're pouring from. At the moment, we will be unable to reheat food within the setting. So it's important that you explain to parents that any food that they send in needs to be able to be served at room temperature, and that they need to send in ice packs to keep it cool for the first part of the day. Prior to eating, it's important that children are encouraged to wash their hands, and again after they've finished eating. It's also important that before and after eating, the area in which the children are sitting is sanitised thoroughly. So before they eat, it needs to be sanitised, and after they eat, it needs to be sanitised again. When you're looking at your daily routines in your bubbles, it's important that you build into those bubbles time for cleaning as you move through different processes throughout the day. Ensure that any cleaning products that are kept within the bubbles are out of the reach of children in secure cupboards. Under no circumstances should you decant a cleaning product from its original bottle. Once the children have settled back into nursery, as settling the children in needs to be the priority, it's important then that you build into the lesson plans information that's age and stage appropriate on hygiene. Consider things like hand washing certificates, which can be issued to children. Children's work needs to be stored within the classroom, and where possible, consider displaying this within the classroom to celebrate their successes. Hard copies of work must not be sent home, but taking photos of work and sharing it through IT, so apps and emails, needs to be encouraged within your setting. At the end of the term, the artwork can be quarantined and then this can be sent home. Some nurseries are currently supported by software and apps, so this is a good approach to take. So you may wish to look into this if it's not something you already have in place. Alternatively, there's lots of modern technology that you could consider using: emails, Microsoft Teams, Zoom. So there's lots of ways that you can manage moving forward and supporting and celebrating the children's successes with parents at home. Send home guidance to parents on the importance of encouraging and supporting independence at home, and give ideas on how this can be done. When you're sending out communication like this, talk about realistic choices. Children can't manage lots of choices, so we should say, should we do X now or should we do Y? Give examples so that parents have something that's modelled for them that they can easily use. As I mentioned earlier, once you've identified your methods of communication with parents, ensure that parents are aware of them, that they understand how to use it if it's an app, and it's important that they know regularly where to go for information and any updates. Also, before reopening, think about sending home ideas for lunches that children can easily eat independently, so finger foods, and share appropriate information on portion size and what constitutes a healthy diet that will support their immune systems. So the roles and responsibilities here for the principal. It's important that as new information becomes available, policies and procedures are updated in accordance with this. It is an ever-changing situation, so the documents that we're using are living documents and need to be regularly reviewed and updated. You need to make sure that you have signage everywhere throughout your settings, and consider using photos and pictures for children with less words. Once you've reopened and you've been open and the children are settled, consider making the children the star of the signage. Children are more likely to pay attention when the signing is meaningful, and if it has their photo with them cleaning their hands and using the proper techniques that we know about with soap and for 20 seconds, then those are the posters that children are most likely to take a note of and follow. As I mentioned earlier as well, make sure that you have in place sufficient supplies. Consider having in place at least 1 week of extra supplies than you feel that you're going to need. When you talk to your suppliers, communicate with them and understand what the lead time is for the delivery once an order is placed. You don't want to be caught out without adequate supplies. Also, have in place a plan B, an alternative supplier, so that you have a steady supply chain in place and that you're confident that you have the adequate resources to operate. It's also important that you ensure that every morning or every evening you replenish the supplies within the bubbles, so that as you have a new day to operate, they have the adequate supplies in the bubble for that day. It may be worth thinking about putting a laminated sheet of paper and a whiteboard pen outside each of the bubble rooms so that they can make notes of what they need, so that those supplies can be dropped outside the classroom so that they can replenish themselves within their bubbles. It's also important that you have in place sufficient supplies of PPE. It is the nursery's responsibility to provide PPE to staff. And also consider how your staff get to and from work. If they're using public transport and your own buses, ensure that they have PPE in place for their transport. As we mentioned earlier, it's really important that you update your policies and procedures, but it's not just about updating them, it's ensuring that you're effectively communicating them out to the relevant people. It's important that the staff have a clear understanding of any updates as they occur, and it's also important that the parents understand the policies and procedures that you have in place so that they're reassured as to what's going on in the nurseries. Consider also training staff on cleaning and the different requirements for the cleaning and the hygiene so that everybody has a complete picture of how things are operating within the nursery. Prior to reopening, you may want to consider having your air conditioning cleaned by a reputable company to ensure that it's fully functional and ready for opening. As I mentioned earlier, as part of the self-assessment, you need to be able to say that you have organised or that you have complete sanitisation of the setting happening no less than 5 days prior to reopening. So it is worth contacting companies and having that in place so that you know who you're going to be using. Also, when you're training your staff, consider including within your training how they properly use PPE, how they clean and with what. So which areas they clean with which chemicals and when that's needed to be done. Share with them the rotas for staff so they know exactly where they're being deployed and how they're going to operate. And ensure that they know what their day will look like. So it's important that staff understand what their day under the new normal will look like, and also for parents what the children's day will look like. Create nursery opening and closing checklists and ensure that somebody oversees this. Again, this could be your nurse, so that you have clear understanding of the hygiene practices within the nursery and people are taking account for what they're doing. The nursery principal's responsibility to ensure that all desks in the admin areas and spaces are cleaned regularly. Encourage your staff, your admin team, to clear their desks and tidy their desks so that they can be easily cleaned, and that paperwork is filed and stored in cupboards so that it's out of the way for cleaning. Consider how you're going to ensure that you have the bedding named and that bedding is not shared between bubbles and not shared between children. Speak to your staff team and encourage an open dialogue with the staff so that they're sharing ideas with you as to how this could be workable moving forward. The nursery staff also have responsibilities when it comes to guideline number 2. It's important that they complete any online training that you do in-house. It's important that their bags are stored and sanitised on entry. So once they come in and you've sanitised them, do you have staff lockers? Because they're not to take their bags into the classroom. If you don't have the communal space for staff to eat their lunches, they're going to need to take their lunches to the classroom and also their water bottle with them so that they don't have to keep transitioning through communal areas. Before children return, ensure that you have everything labelled and it's ready for their return. This means that it's quick and efficient and it's not something that you need to worry about while the children are coming in. When you place the beds down for sleeping, you have to have the required spacing between them. In addition to this, consider having children so that they sleep head up and then next person sleeps with their feet up, and rotate it so that they are top and tailed, as this gives additional space between the children. And most importantly, make sure you build time into the day for hand washing and hygiene procedures. The cleaner needs to understand clearly their roles and responsibilities. They have an extremely important role and it's their job to ensure that everyone is kept safe. It can be quite overwhelming seeing all of the roles and responsibilities together, so consider taking out the roles and responsibilities for the cleaner and putting those onto a separate document that you provide them with so that they can easily see exactly what they need to do and what they're responsible for. It's important that they also understand they must use disposable cloths only, so make sure that you have a really good supply of maxi rolls in all areas for them. The cleaners need to have separate shoes at the nursery that they change into on arrival at work. And then the cleaner's uniform and the nurse's uniform must be cleaned on site and not taken away from the nursery setting. Cleaners also need to ensure that they're wearing protection for their eyes, mouth and nose, and also wearing gloves and an apron if an area has been heavily contaminated, in particular with visible body fluids. Parents are also responsible when it comes to guideline number 2. So send a letter home to the parents and explain how the nursery is going to operate under the new guidelines. Explain what children can and should not bring to the nursery. Provide guidance on what a child at each age range will need to bring with them. This is best if it's done as a checklist. Explain the importance of a hard plastic, easy to clean lunchbox, as the lunchbox will be sanitized daily, as will any bag that they bring with them, so it does need to be able to be wiped clean easily. Either request that the child brings with them bedding that's to remain at the nursery. Again, consider bringing in 3 sets. If you're going to be washing items within the nursery, ensure that you're aware of any allergies that children may have to washing powder. Also, within the information that you send out to parents, highlight to them the importance of independence and the suggestions of ideas, particularly lunch ideas that they would require minimum support to eat. Consider having some online sessions so that parents can get information from you directly and ask any questions and seek any clarifications that they may have. On your self-assessment form, it's important that you have a designated member of staff for health and safety. The nurse is a good person for this, and in your health and safety policy, you may wish to name that person. Although many of the policies and procedures that are required here you probably already have in place, it is important that you go through these and that you check that they cover all of the requirements of reopening post-COVID. Look at how you can manage your stock of hygiene supplies and put in place a system. Again, who will be responsible for the ordering and ensuring that you have these supplies in place? Go around your nursery and identify any touch points. These are areas where people regularly touch, such as door handles, and ensure that these are included within your regular cleaning daily rota. Ensure that your cleaning staff are aware of these areas, and again, highlight to them which cleaning products we use. When you're talking to staff, it's also important that you don't just tell them what they need to do, that you also explain to them why we do it. People are much more likely to do something when they have a full understanding of why they're doing it. Ensure that within your staff training, you've included updates on food handling procedures, and make sure that they're aware of all areas where it's mandatory that they use specific types of PPE. Within your toileting or nappy changing areas, it's worth displaying posters or information that explains to staff members exactly which PPE they need to use, and highlighting that they must change gloves between usage and between children, in addition to changing any toilet, any nappy changing roll, maxi roll that they're on. Also consider how you're going to minimise staff moving in and out of the bubbles as much as you are able to do so. And when you write to parents, think about asking them to bring in water bottles for their children to drink from that have covered mouthpieces, again to minimise the risk of contamination. There's no communal use of sand and water play. And you do need to have in place an emergency deep clean procedure, which would be implemented in the case of a positive case found within your setting. It's important that you include within this how to dispose of the PPE, which chemicals to use, and when and how they are used. Within your reopening plan template, you also have several requirements that need to be added in there. It's important that you have a policy for hygiene that's updated in line with COVID-19 requirements, that you include ideas and samples of the signage, catering for different audiences, so remember adults and children, and that the content within this signage is appropriate to the audience. Remember that signage needs to be laminated so it can easily be wiped clean. You also need to include daily and weekly cleaning checklists. So talk to your team about what they feel is the best way to proceed and have things in place for this. You need to include within this document your food handling policy and procedure. You also need to have information in here on your sleeping procedures, your diapering and toilet procedures, and you need to explain and confirm that you will have masks and gloves provided, and also mention here that you will be providing staff on how to use the PPE that's provided. Moving on to guideline number 3, and this is hand washing. It's important that you develop a policy now in light of COVID-19 for hand washing, and that you share it with nursery staff, parents and key stakeholders to ensure that you meet the requirements. It's important that you ensure that hand soap is used for a minimum of 20 seconds and that hands are then dried on a paper towel. It's important that nursery staff are shown and have information shared with them about the importance of hand washing and that they understand why this is important. Make sure that within the staff's daily routine, they have time for hand washing on arrival, after using the toilet, before and after eating, before and after moving between areas. It's important that you monitor nursery staff to ensure that they're implementing the hand washing protocols within their daily routine. So again, it may be worth highlighting, putting together posters or information that shows the staff members exactly when they should be cleaning their hands. Ensure the availability of the adequate amounts of soap, paper towels and hand sanitizer within your nursery setting, and that these are regularly replenished within your bubbles. As we've mentioned, it's important that you update or you put in place a hand washing policy that is to be uploaded within the documents for reopening. Within your policy, think about having an aim. Why do you have this policy and what are you looking to achieve? Why do we wash our hands? What is the purpose of it? Why is it essential that at the moment we have in place really good hand washing procedures? Then identify what good practice is. What should a good hand washing procedure look like? Then within your policy, there's an opportunity to explain when people need to wash hands, before which activities and after which activities. Then you may wish to talk about the use of hand sanitizers. Perhaps in this space, it would be a good idea to mention that hand sanitizers are not to be used with children 0 to 2 years of age. You may also want to mention here that your hand sanitizers will be wall mounted and out of a child's reach. No policy is complete without the statement of adoption, and this turns a piece of paper into a policy document. So there is a statement of adoption at the bottom there that you could consider including on your policy. We would also normally include a review date, which is usually 1 year on from the date that the policy has been adopted. But at the moment, in light of COVID, it would also be important to put that date in, but remember that all policies and procedures need to be regularly reviewed and regularly updated in light of any new information or guidance that's released at a local level. Again, go and carry out an audit of your setting. Look at where your hand soap dispensers are and your hand towel dispensers are. Are they accessible to children and are they accessible to your staff? Proactively encourage your staff to model hand washing, good hand washing practice for children, and do it with them so that they have active learning and that they're able to understand the process. Staff working with children under 2 need to ensure that they regularly wash the children's hands in their care and ensure high levels of hygiene. Children under 2 must not use hand sanitizer, and children over 2 can use hand sanitizer, but it must be done with close supervision, ensuring that it's stored within the classroom, well out of the reach of children. As I mentioned earlier, it's important that any bubble supplies are checked regularly and replenished in a timely manner. And look at opportunities either in the morning or in the evening to restock and replenish, ready for the next day's operations. Remember that cleaners need to wear gloves at all times when changing supplies. It's important that hand washing facilities are available at the front of your setting for parents to wash their hands at drop-off and collection. One option to consider is a portable sink. If you don't have hand washing facilities available, ensure that you have hand sanitizer available for parents' use. Ask parents at home to also encourage the modelling of good hand washing technique, and also to build it into their routine at home so that there is this strong message between the setting and home of the importance of hand washing and when we need to do it. Also, it's important that we keep in mind that this is a balancing act, and we need to ensure that while children have high levels of hand hygiene, that we don't want to do this to the point that children are becoming worried and concerned. So really look at the balancing act and looking at how we can do this within our settings so that we don't worry children, but we do have in place good hygiene practices. So the responsibility for this is on the nursery staff, the cleaners and the parents. Within the self-assessment guide, there is an area to be filled in. Again, strongly suggest that in addition to ticking it, you put a date next to it so that you can see how your plan is evolving. And any criteria that are partially met or not met, you really do need to put a plan in place so that you're moving every area to the met column. So that you have in place, everything needs to be met on your self-assessment. Guideline 3, the reopening plan template. You need to be able to upload a hand washing policy that reflects COVID-19 requirements. You need to be able to explain how you're going to ensure the availability of soap and paper towels. And you also need to have a statement in there about hand sanitizer. And the signage on its correct usage. You may want to include samples of that there as well. Make sure that your hand sanitizers are clearly labelled that this is not to be used by under 2s. So that is the end of guidelines 1 to 3. So the first part of the training. Rafi, I believe we have a poll.
One last poll before
Could we put that up, please? Thank you. So could you please tell us how confident you are now in implementing the guidelines? Please go ahead and complete the poll.
Promising numbers, Lara, very promising numbers.
Can I just also say that once again, if you have any questions, there'll be, we'll keep going for a couple of minutes once the poll is finished, that you put these into the chat. Please mention before you put your question which licensing authority it pertains to, and those questions will then be taken and they'll be referred to the licensing authorities. And then if you visit the Kinderly website, www.kinderly.ae, you'll be able to go and have a look. There'll be frequently asked questions and responses to the questions that we've been asked today from the different licensing authorities. There's also going to be regular updates and an FAQ page. I think that's going up tomorrow, isn't it, Rafi?
Yes, that's correct.
So you'll be able to refer to the FAQ page. Again, that's come directly from the licensing authorities, so that's another resource for questions. And that should be updated weekly as we move forward with answers to new questions that have been put to them. So again, another good source of information. And finally, there's going to be a Kinderly forum. So again, Kinderly website, and if you go to the forum area, you'll be able to ask any questions that perhaps you didn't ask today, or you go away and you start to work with the guidelines and then you realise you have a question. So you can visit that website, put your question there, and again, hopefully we can get that clarified by the relevant licensing authority. How are we doing?
We're doing good, we're almost there. I just want to inform everybody who's been raising their hands throughout the workshop that we're not being rude or ignoring, but we cannot answer any questions, and they only have to be answered by the relevant licensing authority. So all we can do is take your questions and pass them on to them. But what we can promise you is the minute we do get the answers, it will be on the Kinderly website.
And again, I'm just going through the questions, and people have written questions but not told us which licensing authority they're coming from. So if you don't tell us which authority, we won't be able to get you the accurate information. It really is important, if you've put a question there, that you put that licensing authority. And also remember, this is only part 1 of 3, so we have 2 more parts. Tomorrow we're doing parts 4 to 9, guidelines 4 to 9, and then part 3 is on the crisis management part of the requirements. So again, you still have 2 more parts where we may have the answers for you, so just bear with us there. But as I say, anything else, pop it onto the Kinderly website and we will get those answered for you as we can. How are we doing?
Almost there. Just wanted to also mention that on the crisis management, after the workshop, we will also be training the attendees on how to upload their evidences to the relevant licensing authority, so that it can be assessed and then hopefully get their NOCs.
Can I just clarify, we're not doing that, you're doing that, aren't you?
Yes.
Perfect.
I'm doing that.
Thank you.
All right.
So yeah, that's important that on part 3 that you come along and you bring something to take notes on, because Rafi is going to be confirming with you how to upload information to the platform so that you're ready to go and put your application in for the NOC.
We're also getting some answers on the question answers, and that some nurses are feeling very, very confident.
Oh, that's good to hear.
The next session is tomorrow. There is a morning session and an evening session, and then there's a session on Thursday morning and evening as well.
Yeah, so the morning session is 10 to 12 and the evening session is 6 to 8. Those are in English, and if you're wanting to attend in Arabic, it's 1:30 to 3:30. I think, I hope.
That is correct, yes.
I am, yeah.
Okay,
Brilliant.
So I think we're done with the pool. Yes.
Fabulous. Let's have a look now then.
Are you ready, Lara?
I'm ready. I'm sitting down, Rafi. Oh. I've read the guidelines and I feel confident. We're at 72%. That's good news. If you haven't read the guidelines, I know that the guidelines, some of them came out this morning, so please go away and read them. If you want clarification and you want help to better understand them, as I say, please do put information or your questions or whatever you need clarification on into the chat. That will then be given to the licensing authorities, or visit the Kinderly website and put whatever questions you have on there, and again that will be referred to the licensing authorities. I'd like to say a big thank you for coming and taking the time to attend tonight's session.